Do you feel the burn? Heartburn is one symptom of reflux disease, or GERD, causing burning chest pain and, for many, the need for constant medication. Prevena United Samaritans offers a minimally invasive procedure to treat GERD that, in most cases, can eliminate symptoms and the need for pills.
Probably 50% of the people have some sort of reflux at least once a month, and 10 to 15% have it daily. Some people have it for years, and some people, it's just a recent occurrence. Some people have taken medicine for years, and now it's becoming bothersome even with medicine, and that's generally who comes to see me. It's all done through the mouth. The instrument and a scope is passed through the mouth and the esophagus down into the stomach, and it's all done from inside the stomach. And what happens is we make a new valve between the esophagus and the stomach, and that's really the problem that allows the GERD to happen. We recreate the angle of the valve and the length of the valve, which has been lost. Generally, the workup is to have an endoscopy where we look down in the stomach and look at that valve in the esophagus and see if that's really what they're experiencing. And to have an x-ray where they swallow some contrast and watch that go down through that area also. Generally, people spend the first night in the hospital. The next day they have another one of the swallows to make sure everything goes through okay. And then they go home. But for the next month, they're on a restricted diet. They start off with liquids and kind of gradually increase their food that they can take in their diet from that point. And 75 to 80% of the people are off their medicine as well as not having the symptoms. Some people continue to take their medicine. Some people are afraid to stop their medicine. They've taken it for so long. But some people still take medicine, but generally everyone is better. The advantage to the TIF over an operative or incision containing procedure would be that there is no incision. It's still a general anesthetic, but there's obviously less invasion because there's no incision done. And they have a shorter recovery period from the surgery itself. There are more invasive options. Some people aren't a candidate for this. If they have a big hiatal hernia, for instance, really can't do this new procedure. They would need one of the standard procedures done. So we discuss those options, and they decide whether they want to continue their medicine or if they want to try a surgical approach. There's always something that can be done, whether that's surgical or medical, and would encourage them to talk to their doctor. And there's over-the-counter medications. There's also prescription medications that certainly we could try too. So.
Call 217-477-4734 for a consultation today, or visit us on the web. Eliminate heartburn and start loving food and life again.